Shall I start? Am I audible?
Yes, sir, audible. You can share the
Okay, okay.
screen now.
Okay, perfect.
Streaming is going on, sir. Already started.
Yes, already started. Okay.
Uh, Today it is success.
Okay. So, yes, good evening, everyone. This side, Dr. Abhijeet. And so, our topic for today is plasma proteins. So, we have already started this. Yeah, we have already started this exam mastery classes since June 1, right? And yeah, we are discussing all the important questions that are no important for the upcoming university exam that must be in August, right? Even though it is no beneficial for the students who are appearing for the FMG exam and the NEET PG exam, right? So all important questions, all the previous year questions will be covered over here, right? And all the important topics will be revised in a crisp, concise, and conceptual manner, guys, right? So these are the questions that I will be covering up today regarding the plasma protein. So it's a basically fact-based no part. So we'll be just revising all the important questions that could be asked in the upcoming exam. Apart from that, guys, yeah, these are the core features of the Oracle app, right? We are providing the live classes. Apart from that, all the recorded classes are there on all the video lectures are there on the app itself. Apart from that, all the notes are curated in the form of Q&A. That is the basic format, no, in which your questions are being asked. So they are like a comprehensive book it is, right? And apart from that, after each and every topic, there will be MCQs, yeah, clinical based. Yeah, all the previous year questions will be covered in that, right? So, yeah, apart from that, this is the subscription plan, which is you can see on the screen. And if you want some more available extra discount, you can use my code Dr. Abhijeet 20 for yes. Now, let's start with the what so let's start with the plasma proteins. Just give me a minute. I'll just open the stream. Yeah. just yeah. Now let us start with the plasma proteins, guys. You already know regarding the plasma proteins, right? Just now. Hmm. Now, guys, you already know that. Now, guys, you already know when we talk about the term plasma, guys, when we say about the term plasma, the plasma basically consists of water, right? It consists of water. It consists of electrolytes, right? It consists of electrolytes. It consists of nutrients also. Yeah. It consists of proteins also, and it also consists of hormones also, right? So remember, guys, over here they are asking what are the names of the plasma protein, but before that, just you should know the basic configuration or the basic components of the plasma. It can be water, it can be electrolytes, it can be metabolites, it can be nutrients, it can be proteins, and it can be hormones as well. Okay, now, guys, one question that they have been constantly asking, that what is the concentration of total proteins in the human plasma? Okay, what is the concentration of total proteins in human plasma? That is approximately human plasma. That is approximately 6 to 8 gram per deciliter. That is 6 to 8 gram per deciliter, and it comprises the major solid part of the plasma, right? It's the major solid part of the plasma. Now, when we say plasma proteins, guys, now whenever we say plasma proteins, so you guys should know that the plasma or the proteins of the plasma, they are a complex mixture, guys, right? They do not contain only simple proteins, so they will have simple proteins, and apart from that, guys, they will having some conjugated proteins as well, right? Conjugated proteins we have already discussed, right? For example, the glycoproteins, the glycoproteins. Now, when I say glycoproteins, guys, you already know glyco means the glycogen, the carbohydrate component with the protein. These are conjugated proteins, or there could be some other types of lipoproteins as well. Lipoproteins as well. Lipoproteins as well. So lipo means the lipid combined with proteins. Lipid combined with proteins. Lipid combined with proteins. So guys, you are very well aware of this now, right? Hmm. Okay. So that is regarding the plasma proteins, right? So plasma proteins are not only the simple ones, but we have the conjugated proteins also. And we have discussed like two proteins earlier, also the glycoproteins and the lipoproteins, right? Apart from that, you already know we have the blood, and blood contains two components, right? The plasma that we have already discussed all this, and the cellular component. The cellular component, you already know the RBC, WBC, and platelets, RBC, WBC, and platelets that you already know. And the plasma, we already know. Plasma comprises approximately around 55%, right? Whereas 45% it is the cellular component. So plasma basically consists of proteins, hormones, water, electrolyte, nutrients. And what is the content of proteins in the plasma? That is 6 to 8 grams. And these plasma proteins are basically the simple proteins and the conjugated ones, or yeah, the conjugated being the glycoproteins and the lipoproteins. Now, what are the names of the plasma proteins, guys? Now, coming back to the question, what are the names of the plasma proteins? So just try to remember the names, guys, over here. The lipoprotein. Lipoprotein, it is basically the lipid plus protein component, right? The lipid plus the protein component, the lipoproteins we have already discussed in our earlier videos, right? Please just try to focus on the lipoproteins. Alkaline phosphatase, ALP, right? The alkaline phosphatase. The amylase, right? Angiotensin, guys, the plasma protein, angiotensin 1, angiotensin 2, right? We already have discussed. Gamma globulin, fibrinogen, prothrombin, right? The clotting factors, the albumin, the ceruloplasmin, and the transferritin, right? So that is just the names of the plasma proteins that you have to remember over here. The lipoprotein, the alkaline phosphatase, the amylase, angiotensin, gamma globulin, fibrinogen, prothrombin, albumin, ceruloplasmin, and transferritin. So these are the plasma proteins that you have to remember. Apart from that, what are the functions of the plasma protein? The next question says, what are the functions of the plasma protein? So the very first function, that is the stability of the blood, that is the suspension stability of the blood, right? Apart from that, you should remember the defense mechanism of our body. These are regulated by these plasma proteins, right? Or the fibrinolytic action, right? The fibrinolysis, basically it is by the proteins only. The transport function, right? The transport function, the osmotic pressure, the reserve proteins, the blood viscosity, the acid base balance of the body, the acid base balance of the body, the coagulation. I have already told you these clotting factors. These are nothing but the proteins, right? The plasma proteins that help in the coagulation of the blood and the nourishment of the tissue. That is important. So this is like in broad and short, just you have to remember all these functions, right? Apart from that, let us start. What are the methods of separation of these plasma proteins? Now, okay. The very first method, it is basically the yeah, the salting out process. And this technique, it is basically based on the concentration of the ammonium sulfate or the sodium sulfate. Now, the plasma proteins can be classified or can be separated into three categories over here. First category, we have the albumin, right? Then we have globulin, and then we have fibrinogen. Then we have fibrinogen, albumin, globulin, and fibrinogen. Albumin, globulin, and fibrinogen, right? Albumin, globulin, and fibrinogen, right? Second method is electrophoresis, again being a very important part in the exam, right? See, it is basically used for the separation of the plasma proteins, right? Paper or agar gel electrophoresis with veronal buffer. Basically, it is pH is around 8.6. It's slightly alkaline, right? It separates the plasma proteins, right? It separates the plasma protein. So they are basically divided into 5 distinct bands named as albumin, important, globulin, right? And we are going to discuss about albumin and globulin in detail, guys, in detail in the in another couple of minutes. Apart from that, they can basically these all these no concentrations basically they are estimated by a densitometer, right? So that is something you have to remember over here, right? So that is about the methods of separation. The very first one being the salting out process, and the salt that we are using over here, it is the ammonium sulfate. And according to this, basically they are divided into three categories: the albumin, globulin, and fibrinogen. The other being the electrophoresis, that is the most important one. And under the gel electrophoresis, we are divided into five distinct bands, namely albumin and globulin. And later, these concentration of these fractions can be measured by the help of densitometer. Now, what is albumin by globulin ratio? See, the okay, let us just try to see the concentration. Again, a fact-based question, guys. The albumin concentration of plasma is 3.5 to 5 gram per deciliter, while that of total globulins, okay, it is 2.5 to 3.5. So the normal A by G ratio will be 1.2 to 1.5 is to 1. Okay. Now, now, guys, you already know when we say A by G ratio, A by G ratio. So what is the total concentration of albumin? You already know it is 3.5 to 5.0. Or what is the concentration of globulin? It is 2.5 to 3.5. When you just take the ratio, guys, it will come out to 1.2 to 1.5 by 1, right? So it is 1.2 to 1.5 by 1, right? Apart from that, the A by G ratio, it has certain no see, it is either lower due to the decrease in the albumin, right? Obviously, guys, if the ratio is going down, obviously the upper component will be decreased, right? Or there can be increase in the globulin component. The basic maths, guys, the basic maths, A by G ratio. Either you increase the concentration of albumin, okay? So what will be the A by G ratio? If you just try to decrease the albumin ratio, again the concentration will decrease. Or if you try to increase the globulin part, obviously the concentration will decrease. Now, why if there is a decrease in albumin, now what are the factors now which actually depend on decrease in the A by G ratio? The very first factor that I told you, that is actually decrease in the albumin ratio, right? Decrease in the albumin concentration. And why the albumin concentration will be decreased? The very first reason, it is decreased synthesis of albumin by liver, usually found in liver diseases and severe protein malnutrition. Now, whenever a patient will come to me for no any liver disease, for example, liver cirrhosis or something like that, so always I will know ask the patient to undergo some LFT, liver function test, and in that liver function test, I will just try to focus on this A by G ratio as well. So I will be seeing that the albumin synthesis has been decreased by liver in those liver diseases, the parenchymal diseases of the liver. Apart from that, there is excretion of the albumin into urine. Okay, in the kidney damage, right? Now, even if there is a defect in the kidney, guys, what will happen? This albumin will be coming out of this kidney, right? Or see A by G ratio. If it is how it is decreased, guys. A by G ratio, if it is lowered, we have to. It is reciprocal of globulin. So either the productions of globulins have been increased, so they are basically associated with some chronic infections such as multiple myeloma. Now it's a disorder, guys. I will be covering it in another 10 minutes or another couple of minutes. So in multiple myeloma, what happens? This globulin production is increased. The globulin plasma protein is increased. So what happened to A by G ratio? So A by G ratio, if it is low, it means that the globulin production has already increased. Reciprocate. If globulin is increasing, A by G ratio will decrease. A by G ratio will decrease, and that's associated with the disorder that you have to remember over here. And that's an important part of the exam. That is the multiple myeloma. That is the multiple myeloma, guys, right? Now, coming on to the next question, what is albumin and what is its importance? We have discussed the albumin ratio, right? So it is the major constituent of the plasma protein that you already know. It's the major constituent that is around 60% of the plasma proteins with a concentration that we already discussed. It is 3.5 to 5.0 gram per deciliter. Now, albumin, it is synthesized by, again, a second very important question. It is synthesized by the liver. Okay, now the albumin synthesis is decreased in the liver diseases, guys. Very important. Remember, the albumin synthesis is decreased in the liver diseases. Very important, right? Remember that again a question, the liver produces about 12 gram albumin per day, which represents 25% of the total hepatic. What is hepatic, guys? The liver protein synthesis. So liver protein synthesis, 12% it is by what it is secreting actually this 12, no, 25% of the total hepatic protein secretion. It is just the albumin. And how much albumin is produced per day by the liver? It is around 12 gram. So remember the T half, right? The T half of the albumin, it is approximately 20 days. It is approximately 20 days. All the one marker questions that you have to remember, guys, over here, right? What is the plasma protein with the concentration of this? It is synthesized by the liver, and synthesis decreases in the liver diseases. What is the turnover per day? It is 12 gram albumin per day. And what is the half-life? That is 20 days. So that is something one word that you have to take from here, right? Now, what are the functions of albumin, guys? The very first function, it is the osmotic function, guys. Now, remember, guys, it has a high concentration and it has low molecular weight. Okay, it has low molecular weight. Albumin constitutes to 75 to 80% of total plasma osmotic pressure. That is 25 mm of Ha. So what is the osmotic pressure? That is 25 mm of Ha. So 75 to 80% of the total plasma osmotic pressure, it is basically contributed by the albumin due to two natures, guys. It has high concentration in the blood and it has low molecular weight, right? Now, if the plasma albumin level decreases. Now, what will happen? This osmotic pressure will automatically decrease. So albumin concentration, it is directly dependent on this osmotic pressure, right? Osmotic pressure. Now, if this albumin concentration is decreased, obviously the osmotic pressure will decrease. Now, what will happen? If this osmotic pressure is decreased, what will happen? The blood will be transferred to the, the extra spaces, extra body spaces, extra hepatic spaces which are there, and these will return. What will happen? The fluid will collect in those extra hepatic spaces, and that is something which is called as edema. Edema, guys, edema, right? So edema basically it is observed in kwashiorkor. Again, a very important point that you have to remember, guys, over here. It is observed in kwashiorkor. Yes, a disease of protein energy malnutrition, where I have already told you kwashiorkor and marasmus, right? In kwashiorkor, the edema is observed, and that edema is basically due to the collection of these extra or the fluid retention in the body, and that fluid retention, it is why? Because the osmotic pressure has decreased. Why the osmotic pressure has decreased? Because there is a low concentration of albumin, right? So that is just a drastic reduction in the plasma albumin levels, a drastic reduction in the plasma albumin levels, right? Coming on to the next, that is the transport functions that are performed by the albumin. So basically, you already know the plasma albumin for now you for example, guys, if suppose this is the blood, suppose this is the blood vessel, right? This is the blood vessel, and in the blood vessel, you guys already know these have plasma. Blood has two components: the RBC, WBC, and platelets. And along with that, guys, you already know we have the plasma component also. The plasma component. So you can see the plasma component over here, and over here. If I'm saying that the plasma albumin will be binding to no important compounds. So basically, these plasma albumin will be bounded to the free fatty acids. Okay, this is okay. This is what? This is the albumin, plasma albumin binding to free fatty acid. It can bind to bilirubin, right? It can bind to bilirubin, or it can bind to steroid hormones, calcium, copper. So basically, they are not transported like in free form, guys. They need something which will help them to transport in the blood, and that is something which is no by the plasma albumin. And these plasma albumin basically help these free fatty acid, the bilirubin, the this and that. So yeah, that is the steroid hormones, calcium and copper, to help them transport in the blood, right? Apart from that, guys, it has nutritive function also. It is, you already know, albumin serves as a source of amino acids, right? For tissue protein synthesis. This is something very basic, guys, right? Apart from that, remember, it has a buffering action also. What is now the clinical significance of albumin? Now, you already know, I have told you that this albumin, it is binding to certain compounds in the plasma, right? And that prevents them from crossing the blood-brain barrier. Okay. For example, if we have the albumin bilirubin complex. This albumin is a plasma protein. It is binding with the bilirubin. Albumin, we have the free fatty acid complex. Okay. Now, so basically, what is happening, guys? So this albumin is basically binding with this bilirubin, the free fatty acids, and they are basically preventing these compounds to reach to the brain, because they are not entered by this blood-brain barrier. So when I say albuminemia, hypo means decreased albumin, decreased albumin in the blood. Emia means blood, decreased albumin in the blood. Okay, and that is observed in malnutrition, guys. That is observed in malnutrition. I already told you Kwashiorkor disease, right? Apart from that, we have the nephrotic syndrome. Okay, the diseases of the kidney and the liver infection. That is the cirrhosis of the liver, the fatty liver, guys. The cirrhosis of the liver. That is the fatty liver, guys, right? So albumin, it is basically excreted into the urine, right? And that is called as albuminuria, right? In nephrotic syndrome and certain inflammatory conditions of the urinary tract. Again, remember, guys, that microalbuminuria, it is 30 to 300 milligram per day. It is clinically important for predicting the future risk of the renal diseases, right? So, right, guys, remember that this albumin, it is basically used for the treatment of burns, right? And hemorrhage also, right? So it has some clinical advantage over here, that it is used for the treatment of burns and the hemorrhage, right? So that is something you can see. The human serum albumin, it helps in antioxidant and free radical scavenging, anticoagulant, anti-inflammatory action, the osmotic pressure maintenance, the drug transport, right? Effect on the vascular integrity and the transport properties, the free fatty acid, the bilirubin component. Now they are combining with this albumin, and this helps in the free transport of this, right? So let us come to the next question. What is globulin and the important globulins? So you already know they are separated into four distinct bands, the A, B, and the R globulins. So basically on the, yeah, electrophoresis. So basically, remember what, if I just compare the albumin and globulin, so remember the globulins are basically bigger in size. They are bigger in size than albumin, and they also perform a variety of functions which is like similar to the albumin, that is the transport and the immunity one. Now, alpha 1 antitrypsin, guys. Alpha 1 antitrypsin, I don't know why it's written. Alpha 1 antitrypsin. Remember, beta, it is a major constituent of the alpha globulin fraction of the plasma protein. So, antitrypsin, it is a serine protease inhibitor. Now, what is it combines with trypsin elastase and other protease enzyme and inhibits this activity. Now, guys, why this alpha 1 antitrypsin deficiency? Now, guys, remember there is something called as alpha 1 antitrypsin deficiency. Now, this is something very, very important. Let us just try to discuss one clinical case over here that is called as emphysema, guys. This you will be learning in your second year, but let us first focus. So, beta, there are two lung disorders that I'm like, only one I think over here I will be focusing on. That is something called as emphysema, guys. Now, what is happening? Basically, the alveoli part or the conducting path, no, they have an abnormal distension of those alveolus. What will happen? Now, air will come out, but it will never be able to escape out, guys. It will never be able to escape out. So that is just now this emphysema, basically it is occurring due to deficiency of this gamma antitrypsin, right? So what is happening, guys, over here? Now, what happens, guys? There is an increase in the activity of the macrophages to release elastase. Now, what happens? The most common cause of emphysema being smoking, guys. Okay, being smoking, guys. A chronic smoker, no, a 10-year, 15-year history having smoking, guys, he will come to know with complaints of shortness of breath, right? And every possible thing, no, that a smoker faces. So remember, guys, that what is the pathogenesis behind that? There will be an increase in the activity of these macrophages, which release elastase, guys, that damage the tissues of the lung. Now, in the normal circumstances, this elastase is basically inhibited by alpha 1 antitrypsin enzyme. Alpha 1 antitrypsin enzyme. Right? Alpha 1 antitrypsin enzyme, this basically inhibits this elastase. Now, what is the most common cause of emphysema, guys? Emphysema. What is the most common cause? Emphysema. It is the again a very important question, a very important viva question. That is the smoking. That is the smoking. Now, guys, what the smoking does? What the smoking does? So, what is the effect of smoking? So, what will happen? This alpha one antitrypsin will actually be decreased, guys. Alpha one antitrypsin will decreased, right? The amino acid methionine at position 358 of antitrypsin is involved in binding with the proteases. Now, what is the smoking will cause? The smoking will cause the oxidation of this methionine to methionine sulfoxide. Now, what will happen? This antitrypsin with methionine sulfoxide cannot bind and inactivate proteases, cannot bind no and inactivate these proteases. What will happen? So obviously, this elastase activity will be more increased and it will damage the lung tissue, right? So heavy smoking, I'm already told you a person having no chronic smoker of 10 to 15 years, right? And situation basically becomes worse if this alpha 1 antitrypsin is also like inhibited, right? So that is accumulation of this mutant, okay? And that is can lead to even in the damage of the liver also there could be fibrosis of the liver that is called as the cirrhosis, right? So that is something you have to remember. Coming on to the next one, alpha 2 microglobulin. So basically, it has a high molecular weight, right? So it like Dalton, right? The protein alpha 2 macroglobulin inhibits protease activity and serves as an anticoagulant. Very, very important question. It inhibits the protease activity and serves as an anticoagulant. So again, these levels are elevated in the nephrotic syndrome. Okay, so remember, guys, why the levels are elevated in the nephrotic syndrome? That because the low molecular weight proteins are lost in the urine. So that is, guys. If you just take bit a low one has already in nephrotic syndrome. What happens? Basically, all the small weight proteins will go out through the urine, and obviously, what is remaining, guys? This like it's a false one, false reading, like the pseudo one, because already the small ones have been washed out. So only these macroglobulins will be there. So that's why the levels are like elevated or increased in these nephrotic syndrome, right? Coming on to the next one, guys. Name two plasma proteins and mention their role. The first one, it is the celluloplasmin and the albumin. Celluloplasmin, you should know, it is a blue-colored copper-containing globulin. Now, it is cellulose something copper plus globulin, right? Globulin, and it gives blue color, right? It gives blue color, right? So remember, right? Celluloplasmin binds with almost 90% of the plasma copper, right? So remember, it is a tie. Copper from cellular plasmid is not readily released to the tissues. So albumin carrying only 10% of plasma copper is the major supplier of copper to the tissues. Otherwise, no. The other one, the majority of the cases, it cannot like no freely released in the tissues, right? So the cellular plasmid, this basically they produce oxidase activity, and it is something which is related with Wilson's disease. Very, very important. Wilson's disease, guys. Wilson's disease, right? The Wilson's disease. Okay. So, yeah, the next one. Yes. Again, list of important diseases that you have to remember where the ceruloplasmin levels will be low. It is the Wilson's disease, the Menkes disease, the copper deficiency, obviously. All the copper has combined with the ceruloplasmin. So obviously the levels of copper will be decreased. Aceruloplasmin plasminemia, right? The ceruloplasmin levels has been decreased, and the zinc toxicity also. Even you will see the high ceruloplasmin levels when there is copper toxicity, when there is much more copper than required in the blood. Apart from that, if there is any short or long-term chronic, acute or chronic inflammation, right, that can also lead to high ceruloplasmin level. Even in the pregnancy, guys, again, a very important question for the exam. In the pregnancy level, we have high ceruloplasmin levels, just like the physiological change in the pregnancy, guys. The physiological changes in the pregnancy, once you will come to fourth year, you'll read that. That is the normal high ceruloplasmin levels will be there. And even in the rheumatoid arthritis, guys. No. What are immunoglobulins and what is the structure, guys? Very important question from the exam point of view. Yes, so immunoglobulins are a specialized group of proteins. Basically, they are having globulin fraction, right? So immunoglobulins basically consist of two identical heavy chains, right? We have the two H chains and two identical light chains. And these two heavy and light chains, basically, they are held together by disulfide linkage. They are held together by disulfide linkage and non-covalent interaction. Now, remember, guys, this immunoglobulin, again, very important. It is a Y-shaped tetramer, right? H2L2. Two heavy chains, two light chains held together by disulfide interactions, right? Each heavy chain contains approximately 450 amino acids. Very important. Okay. So sir has started with immunoglobulin structure. Now immunoglobulin consists of two identical heavy and two identical light chains. They both are connecting together with the help of disulfide linkages, right? And heavy chain contains how many amino acids? 450. And light chain has 212 amino acids. Again, these two are very important Viva questions. Very important Viva questions, right? They are heavy chains are linked to carbohydrates. Hence, immunoglobulins are also called as the glycoproteins. Right, the immunoglobulins are called as glycoproteins. Why? Because the heavy chains of these immunoglobulin, they are connected with the help of carbohydrates. They are connected with the help of carbohydrates, right? Each chain, light or heavy, of immunoglobulin has two regions, domains, namely the constant and the variable, right? Constant and the variable, right? Has two regions, constant and variable. So remember that the amino terminal half of the light chain, it is the variable chain, right? While the carboxy, okay, the terminal half is the constant region, guys, right? So remember that there is 1/4 of the amino terminal region which is variable, while the remaining 3/4 are constant. Now, IgM is the first antibody to be produced in response to an antigen. Again, a very important question. Which immunoglobulin? It is the first one to be produced in response to any antigen. Antigen, any foreign particle, no, getting entry into your body. And what is in response to that particular antigen? The first antibody that will be produced, that is called as the IgM, right? And that's the most effective against invading microorganisms. So that is something you can see. We have the light chains and we have the dark chains, right? So we have the variable region, that is the antigen binding site, right? And we have the constant region, right? Now we have different immunoglobulins, and these are very important. Always I ask you to put dollar sign over here. These are very important. IgG, immunoglobulin G. So remember, guys, the very first question, it is the most abundant antibody in the blood. Second question, it is smallest in size among all the immunoglobulins that they are there. So like you have to remember GAMED, right? GAMED. So first we are discussing the G1, that is the immunoglobulin G. It is the most abundant one, right? Most abundant, right? It is smallest in size and it provides long-term immunity against infections. It provides long-term immunity against infection. It can cross the placenta. It can cross the placenta, giving passive immunity to the fetus. It can cross the placenta, giving passive immunity to the fetus, right? Immunoglobulin A. Basically, the immunoglobulin A, it is found in secretions like saliva, tears, and breast milk. It has a dimeric form. Remember, guys, this immunoglobulin A basically it protects the mucosal surface, okay, and prevents pathogens from entering into the body. That is something you have to remember. The function of the immunoglobulin A. Apart from that, guys, coming on to the next one, IgM. Remember, guys, M basically the largest antibody in size, right? It is the first responder to new infections, right? The IgM, I've already told you, the first antibody which is synthesized in response to any allergen that enters into the body, right? And it helps activate all the complement system, all the protein system in the body to fight against that infection, right? IgD, right? It is found on the surface of the B cells, right? We have the B cells, the immunity cells, the B and the T cells. So it is found on the surface of the B cells. And remember, it is helping the B cells, the activation of the B cells, which is no required in the immune response, right? Obviously, whenever if the B cells will not be activated, obviously they cannot fight against any allergen that is entering into the body. Apart from that, the properties of IgE, basically remember it is normally present in very less amounts, right? And it is important in allergic IgE, allergy guys. Always know whenever you get a case of asthma or a pollen grain dust energy, every time they know they will try to mention some allergic component in the question, and that is something you have to remember, that any allergic response, which immunoglobulin it is, the IgE, right? All the allergic reactions, right, triggers allergic responses by binding to mast cells and the basophils, and that release to a component called as histamine will be released, right? Now, guys, coming on to the next one, what are the acute phase proteins? So basically, they are non-specific. Basically, they refers to a non-specific response in the stimulus of any infection, guys, any short-term infection, any injury, any inflammatory condition that is affecting any tissue or something, that is acute phase proteins. So basically they are a characteristic pattern of changes in the plasma protein levels. Basically they're called as the acute phase proteins. So basically what happens if there is any kind of infection, if there is cancer, if there is injury, or any infection, that is affecting any particular tissue or an organ, right? What will happen, guys? There are something called as a positive acute phase proteins. Basically these proteins will be increased in no during inflammation. For example, celluloplasmin complement proteins, the C-reactive protein, CRP, right? So CRP is basically the protein which will be increased in response to these injuries, right? So again, whenever the CRP levels are increased in the blood, it automatically indicates that there is some sort of infection, right? Apart from that, we have the negative acute phase response. Basically, during the acute phase, the synthesis of certain plasma proteins decreases, and they are termed as the negative acute phase. For example, the albumin and the transferrin, which I told you, which are very, very important. And obviously, if there is any infection, the levels of these albumin will decrease. Coming to the next one, that is the C-reactive proteins, guys. The C-reactive protein, you already know, it is also called as the CRP part, right? It's a major component of the acute phase proteins. Again, guys, what is the site of production of the C reactive protein? That is the liver, and it is present in circulation in minute. That is less than 1 milligram per deciliter. Less than 1 milligram per deciliter. C-reactive protein, basically the C component stands for the carbohydrate, guys, right? To which it binds on the capsule of pneumococci. Pneumococci, the bacteria, right? Is involved in the promotion of the immune system through the activation of complement cascade proteins are there, right? Cascade proteins. You'll learn this in pathology next year, right? Apart from that, remember the estimation of the C-reactive protein in serum is important for the evaluation of acute phase response. Obviously, I told you if the CRP levels are increased, it automatically indicates that there is some sort of infection, right? Even if there is a normal surgery, the serum, the blood, in the blood, the CRP will increase and it will return to a normal level within 7 to 10 days. But if the recovery is complicated by any infection, it will be reflected by continuous elevation of, if suppose there is a normal surgery, guys, in the normal surgery, after the normal surgery, I've sent the blood sample. In the blood sample, if I want to estimate the CRP levels, it will be increased only. But after 10 days also, if it is increased, it ultimately indicate that no, this surgery has been complicated by an infection, and that is a constant sign that will be seen continuously because the CRP levels are automatically normal by 7 to 10 days. But if it is getting constantly increased, so it means that it has been sort of some infection over there, right? So remember, they are also, the increased levels are basically, we can also predict the risk of these coronary heart disease. Okay, the coronary heart diseases, right? So that is the increased levels of no C-reactive protein. It can be in obesity, infections, cancer, sepsis, allergic reactions, heart diseases, type 2 diabetes mellitus, atherosclerosis, where the vessel walls, they are complicated by these plaque formations and all, right? So yes, coming on to the next, what are the transport proteins, guys? So they are integral components of the cellular membranes, right? So remember, there are various types of transport proteins. The first one, it is the ion channels. The first one, it is the ion channels, and they create pores in the membrane. They create pores in the membrane and enabling specific ions to pass in response through various stimuli, okay, such as voltage or presence of ligands. Transport proteins, guys, again, a fact-based part that you have to remember. It is also known as the carrier protein, guys. It binds to specific substrates on one side of the membrane and undergo conformational change to transport them to the other side, right? So from one side, they will be binding with it so that the membrane can undergo some changes, the conformational changes, and they will allow this part to know these molecules to come inside. So these are called as the transport proteins. Apart from that, we have the sodium potassium pump. If you already know about the sodium potassium pump from physiology, basically they use the energy from the ATP hydrolysis. The ATP, it is broken down into ADP plus IP with the help of water. And remember, these sodium potassium pumps, right? These sodium potassium pumps, basically they work with the help of this ATP. Apart from that, remember that uh, yeah, the transport proteins, they will exhibit high specificity for a particular molecule, right? So they are selective in nature also, the selective transport also basically. So they're selectively designed to transport only some material, right? So that is something, the specificity of the transport proteins. Now, guys, the next one, that is what is multiple myeloma. I already told you that multiple myeloma, it is basically a cancer that is originating from the plasma cells. That is originating from the plasma cells, right? So it approximately it is 1% of all the no cancer cases. Apart from that, it is basically a single clone of the plasma cells in the bone marrow. Basically, leads to the abnormal production of the immunoglobulins. All the proteins will be like not be overproduction of these abnormal immunoglobulins. Now, what is actually the cause, guys, over here? There is one uncontrolled proliferation. Keep on dividing, keep on dividing, keep on dividing, and that too dividing is not basically the normal one. It's the abnormal production of these immunoglobulins. So basically, the majority, it is the IgG which is produced, right? Apart from that, IgA or IgM, it is approximately very low, about 25%. So abnormal immunoglobulin G will be more produced in multiple myeloma as compared to IgA or IgM, right? So basically, they now, what are the clinical features, guys? You already know, obviously, the immunoglobulins will be less, right? I mean, the normal immunoglobulin synthesis will be less. What will happen if the immunoglobulins are less? There will be decreased immunity. There will be decreased immunity, so they are more susceptible to recurrent infection. For example, a normal person having an infection can easily fight with that infection because of the presence of the normal immunoglobulins in the body. Whereas a person no having multiple myeloma, what is happening? There is not abnormal production of immunoglobulin, or the immunoglobulin which is produced, it is not working normally. What will happen if there is a normal infection also? He will be not able to fight that good that a normal person can, right? Remember, Kai's next one, that is the Benz-Jones proteins. They are excess light chains of immunoglobulins, right? So they are a hallmark of multiple myeloma. Again, a very important question. The Beck-Jones proteins, they are a hallmark of the multiple myeloma, right? So even approximately like 20% of the patients, right, they excrete these proteins in the urine, which can damage the renal tubules, guys. They can damage the renal tubules. So that is the common signs and symptoms: the confusion, drowsiness, recurrent infections, the bone pain, bone fractures, right? Unexplained weight loss, cancer is there, right? So that is something that you have to remember, right? So again, pathogenesis, guys, you already know it is the overproduction of the plasma cells in the multiple myeloma, right? So obviously these plasma cells will produce abnormal immunoglobulins, now which can accumulate in the tissues, leading to condition like amyloidosis. This you will learn in pathology next year. Now there are various tests, and I would say the specific tests which are no able to we can detect the presence of these Benz-Jones proteins. So including the electrophoresis of the concentrated urine, the classical heat test, the Bradshaw's test, right? Now, Benz-Jones proteins, right? Remember, it is first described by the Henry Benz-Jones in 1847, where there is excess light chains of immunoglobulins. Proteins have a molecular weight of 20,000 to 40,000, right? Up 20% of the multiple myeloma patients excrete these proteins, right, which can damage the renal tubules, and they can be detected by this process. Like accumulation can result in amyloidosis, which I already told you. We'll be discussing it in the pathology next year, right? So yes, the light chain, it is excessively produced, and this excessive light chain production, can be deposited in various parts of the body, such as the liver, kidney, and intestine. So yes, electrophoresis, we have already told you the Broad-Shaw's test, right? Uh, Involving the layer of the urine on the concentrated HCl, right? So of to form a white precipitate ring. So that is something you have to remember. So that was about for today. So you can just follow all the social media handles which are displayed on the screen for the further updates of the classes, guys. Thank you so much. And this was just a fact-based today class. So we'll be starting with the hemoglobin ASAP, right, in the next week, where we'll be discussing all the metabolism part and disorders. Thank you so much.